been a big week for healthcare coverage in the U.S. as a new online market officially opened for business under Obamacare. There's so much confusion out there about the different plans and who has to sign up. Well, this morning we're going to try and clear up some of that confusion. Insurance expert Craig Gussin is here joining us this morning. Now, actually, you have a very impressive title, Certified Healthcare Reform Specialist.
Yeah, and
you are a specialist in this.
I specialize in health insurance, and we took a, I got a designation for taking a class to learn more about healthcare reform.
But even you are confused about all this.
Totally confused, because as we were talking before, if you go to Covered California's website, you find a plan you think is perfect for you, you go on, you sign up, you do everything. It's a very good chance that if you like a doctor or hospital, that doctor or hospital will not be on the plan. So then you got to go find the doctor and hospital, which I can't find on their website. Talking to Covered California, they tell me, well, you have to go to the insurance company's website and look it up. But the plan you pick and where you go to let's say, the insurance company's website, that may not be the same plans, and you may end up thinking you have a doctor you don't have. There are some plans that don't cover SHARP, or don't cover scripts, or don't cover both. So if you have a certain hospital or doctor you want, you may not get that doctor based on the plan you pick. So what we're recommending to everybody is just wait. Wait till at least
some time.
Yeah, we have a lot of time. End of October, beginning of November, you can sign up. Everything will be great. And also understand the plan. The biggest concern that we have is I've been working with people, and what they're telling me is, okay, I get a subsidy. That's fantastic. What's it going to cost me? And I said, $2 a month. They said, what's my copay for doctor visits? I say $60. I can't afford that. What's my deductible? $5,000. I can't afford that. So yes, they're paying $2 a month for the insurance, but they can't afford the benefits they're getting for $2.
Okay, before we get into the subsidies, let's get into the fact versus fiction. We have some stills right now. I want to separate this fact from fiction. Can I keep my current health plan? If I have a health plan, does it have to change under this new Obamacare?
In almost every situation, it has to change unless you bought a policy before March 20th, 2010 and hasn't made any changes to it. Now,
why is that?
Because that's just the way the law is. If you had a plan that was before the president signed the law, it's grandfathered. But between then and today, you can't change your copay by more than $5 or your deductible by more than 5%, which is almost impossible.
And what about, can I buy health insurance whenever I want?
No, you can only buy it up to April 1st, and after from April 1st on, you cannot buy health insurance in the United States of America unless you have what we call a qualifying event. You get a new job, and they offer health insurance. You can do that. You get divorced, you get married, you can get it then because that's a qualifying event. You lose your job, then you can go and you can get individual coverage within 90 days. But after 90 days.
There are some loopholes there. It's certain. How about I just pay the $95 and I'm set. I don't have to pay for health insurance.
That's an option. But again, if during the year you get sick, you're going to be required to pay all the medical expenses. And they're very serious about this. They're going to come after you. Whatever you got, they're going to take to pay that bill, because you had an opportunity to buy health insurance. There's no more excuse of, oh, I was uninsurable. Everybody in America can buy health insurance, and if they don't buy it, they're going to pay a fine plus have to pony up and pay for the health care cost.
And you've told me before there are some people who qualify for these subsidies who don't realize that they actually do. There are 4 different plans. We have the platinum, the gold, we have the silver, and the bronze. We have them up there on the screen right now. Can you go through each one real quickly and tell us who actually qualifies for the subsidies?
Qualify for subsidy, you have to make between $16,000 and $44,200 as a single person. Family of 4 can make $92,200. You're going to qualify for some subsidies. But here's what I discovered. If you're a single person and you're making more than $28,000 a year, you're really not going to get much of a subsidy unless you're over age 50. So at 50 or person 50 to 64, they can still get a decent subsidy until they're making about $35,000, $40,000 a year. But if you're 30 years old,
and again, we're talking about individuals, it's not even families.
Not even families. But in today's world, there's a rate for you, then there's a rate for your spouse, and there's a rate for all your kids. Come January, everything changes. There's a rate for you, there's a rate for your spouse, there's a rate for your first child, second child, and third child. If you happen to have a child over age 20, they have their own rate on top of that. So it could get very, very expensive. And that's a concern I have, because when we look at numbers, and we have a 46-year-old today with a high deductible plan to cover catastrophic, he's paying $192 a month. That same plan, but the deductible is another $1,500 more, is almost $300 a month come January for the same or similar plan. So we're recommending work with your agent, find a plan that meets your particular needs, and make sure that your doctors and your hospitals are on the plan and that you're comfortable with the benefits.
Key advice here, get educated, know what you're getting yourself in, even shop around.
Shop around. Any agent you work with that belongs to the San Diego Association of Health Underwriters can work with you and help you, guide you through all the different plans and explain all the benefits so that you pick a plan that's best for you. Because to pick a bronze plan, which is the least expensive,
may not
work because you can't afford a $5,000 deductible, with a gold plan or a platinum plan has no deductible. And the silver plan has a $2,000 deductible, but if you get enough subsidy, that deductible comes down. So there's a lot of things you can do. You just got to be educated and wait. Because we don't know everything yet.
That's another #1 piece of advice, just wait.
Just wait, we have a lot of time.
All right, thank you for being with us this morning. We certainly do appreciate it. Craig Gussin, insurance expert, thank you.